Okay, so we're recording now. So let's see, Dr. Brennan is there. So hiya, Don.
Hi, Noel.
How you doing?
Good, thanks.
You're looking very
Hello,
smart
Dr.
there.
Brandon.
Hi, hello, Dr. Raj. How are you?
Good.
Hello, everybody. Isabel.
You're wearing the pink for ladies today.
Oh, absolutely.
Thank
I
you.
have to be.
Actually, Raj was saying she's going. Raj is doing the first presentation, but she was saying that because it's the last day of the 9 days of Mother Divine, she's actually going to do a chant for that particular day. You know, so that'll be a really nice way of starting off the course, because this time is very specific for ladies in the Vedic calendar. So Raj is going to do.
This is called Navaratri. So Navaratri is the 9th day of Mother Divine, and today is the 9th day. So the tradition was in India when we were young, like little girls, our neighbor would invite us, like they want 9 girls, and then all the 9 girls, they will wash their feet and they will put a little kind of a little kind of kumkum, like saffron on the third eye, and they do the puja of the girls and they serve them food. So that was the 9 divine mothers. So I miss those childhood days, and when we were treated very special on the day 9th, and all of us were given money as well. So that was the interesting part.
Oh, it sounds like a lovely tradition.
Yeah, it was a very nice.
No, Vijay Nahid is here.
All right, let's get Nahid. Sorry, there's just still people looking for the link, so that's why I'm looking down at my phone. There's still people texting for the link. So let's see. Hi, Dr. Nahid. I'm not sure if you. Yeah, hi, Dr. Nahid. Hey, hi.
Hello, Dr. Nahid.
Hi, Dr. Nahid.
Hi, Dr. Brennan. How are you?
Very good. Thank you very much.
You are looking very handsome today.
Oh, thank you.
Especially for all the beautiful women. Are you ready for like all the benefits?
I'm slightly overwhelmed, but I'm taking courage. I see.
Noel is there. Noel is there.
Yeah, and Price has wore a white shirt today. Oh my God. They all are dressed up more than us, Dr. Rajvinder.
No, you look beautiful.
We don't need to dress up. That's it. You're just beautiful as you are.
Thank you.
Okay, so the numbers are joining in now. We've 35 on at the moment, but there is about 70 people booked for the course. So, and it's still only 27 minutes past. So Anna Carey is on. Hiya, Anna. She says, very lovely tradition. Yeah.
Yes, Anna, yeah.
If you're a girl, it's a lovely tradition.
Sometimes they couldn't get the 9 girls, so they had boys as well, dressed up like a girl.
Oh my God. And then they counseling years later, yeah.
No, they wanted the little money.
Wanted the money,
okay. Oh, yes, of course.
And then for 7 days, they do fasting. They don't eat salt, they don't eat onion, garlic. So today is the ladies break their fast as well by cooking very lovely meals. And
okay, so they fast for the 9 days, do they? They go on a cleansing tradition as well.
Cleansing tradition as well.
Okay, very good.
Yeah, well, that's interesting because too much salt creates wrinkles, doesn't it?
Yeah. Probably.
Drying up the tissues.
And then tomorrow is the Dashara. The Dashara is the victory of the darkness over the victory of truth over the evil. So, and then Diwali, the festival of light, is on the way. So it's all the festival time started after.
When is Diwali on?
I don't remember. I know the exact date, but I think it will be 13th of November, mid-November. It will be the 15 days after the Navratri. After the Dashara is the 10th day, and then I think
Isn't it very interesting that after 9 days of Mother Divine, you actually have truth overwhelming darkness?
Yes.
It's
because
fantastic.
If people know Ramayana, if anybody have read the Ramayana, the mother Sita and the wife of Rama, Lord Rama, was kidnapped by Ravan. He was a very, very wise man though, and his castle was like made from gold, but he kidnapped Mother Sita ji, and he wanted to marry Sita ji. And then Hanumanji came, and Hanumanji protected Sita ji when she was in his custody. So it's just like the Dashara is on the day of Dashara, Ramji killed Ravan, and brought Sitaji back. So that's when they came back to their own kingdom. So people light it up with the candles and the diyas, the little candles made from wood. So that was celebrated as Diwali. So
Yeah,
that's
yeah. Oh, it's a huge festival in India and all around the world now. Actually, Diwali is celebrated all around the world. So it's the one I like is Holi though.
Holi is the colors.
Yeah.
You get to throw colors on everybody. Yeah,
And that's come in the springtime.
yeah. That's a great festival.
And today, a lot of people will be dancing. It's like a Navratri. It's a big parties and traditional dress up and dance and all.
Oh.
There's a fascinating interpretation of the Ramayana in terms of our health, whereby Ravan represents really a gross disturbance of the nervous system and the health, and Ram represents the higher functions which regain control. And so it's the indication of perfection of the physiology, coming back to perfect health and enlightenment and light and wisdom and love and joy, and a perfect civilization emerges out of that. So it's fascinating.
Yeah, I would like to read that book Ramayana in your physiology, maybe.
Yeah, I'm halfway through it.
Are you? Oh, very good.
It's my reading at bedtime at the moment.
Oh, wow, nice.
It's
Very
lovely.
nice. Maybe I can hear it from you and save my time.
Yeah, all these individual personalities, like Hanuman is representing the hormonal system, and how that is the communication with all parts of the physiology, and how it is Hanuman that manages to communicate with Sita at the start. And so it's just very fascinating correlations, so extraordinarily correlated with what's going on in the physiology, the various personalities and events.
Oh, very good.
Interesting.
Okay, so let's see. We have 59 people on. I'm just getting the odd text in from people saying they can't find the link, so I'm just sending it back to them. But we won't wait too much longer because we want to. We've a lot to get through. So just to let you know what the format will be this afternoon, Dr. Rajvinder will make her presentation. Dr. Brennan will make his presentation. We might we'll see, we might take a 5-minute stretch break. I'll just see how long those take. You know, it's always good to get up and walk around the room just for 5 minutes and stretch your limbs, you know. And then Dr. Naheed will make the final presentation. And then after that, we'll have a Q&A. So hopefully we'll have a fairly decent length of time for the Q&A at that. Then everything's going to be recorded, and the recording will be made available to everybody for a week. So you'll have a week to review it. We do show these again later on in a few months' time. This one is live, just in case anybody's thinking. So we're here live on the Saturday, the 24th of October. So, but we will replay this as a recording in a few months' time. But I'll put it up on YouTube. I'll send you a link to it. That'll be active for about a week. And so don't worry too much if you don't grasp everything, because just relax, take it easy, let whatever sinks in. And then the important things, if you feel you didn't catch something, you can just go back over it. And
just tell the format as well, who is talking what. So for people's interest to stay engaged, we are covering everything on the woman health, what everyone is covering different. So maybe talk
well, you just described that there, Rajvinder. You had the meeting with Dr. Brennan yesterday, so if you want to.
Okay, so I'm covering the basics about the cycle, because there's so much around the cycles, it's hard to cover everything. So just basic advice and just what are the issues. And Dr. Brennan is covering infertility, and advices, and his area will be around the infertility. And Dr. Naheed is going to talk about menopause. So probably we have all different age group of women here. So if you think, oh, this is not for you, this is not for you, so you have to be patient and stay until the end. And so everything will be covered. So hopefully.
Okay.
And then we'll take questions. I hope we will finish in 1 hour, 3 of us, and then we will leave. I don't know how long, 30 minutes or 1 hour, whatever you want to take for the question answer session.
Yeah, we'll do the questions now. And we have a summary put together as well. So as we have with all our webinars. So I'll be emailing that out to you, possibly not tomorrow, but Monday morning, I'll email out the summary. And with that summary, you'll have the link to review the whole webinar as well, you know. So, okay, listen, I think we're there. We're at 64. So there's a few more people to log on, but I think we should start because we don't want to leave it too late. So I'm nearly assuming that everybody on this call has been with us in one format or another before. In other words, they've been on our courses or they've seen some of the doctors, but there may be a possibility that maybe there are new people here. So I'll just introduce the doctors as we go along. So our first speaker this afternoon is Dr. Rajvinder Kaur. And Dr. Kaur is an Ayurvedic doctor. She came to Ireland in, I think it was 2007. So she's been here for quite a while. She's worked with the Ayurveda Center ever since then. She specializes in ladies' health. She also runs our spa, and she does an awful lot of our cookery courses as well. And she has a wealth of knowledge in Ayurvedic healthcare, and also in dealing with Western patients, because it probably is slightly different than dealing with Indian patients as well. So Dr. Kaur is going to do her presentation. As she mentioned there, she's going to be talking about the menstrual cycle. So Dr. Rajvinder, I'll hand over to you, and you can fire ahead.
Okay, thank you. Now, so if you allow me to share my screen, and then I'll be.
Okay, you should be able to share your screen now.
Yep, thank you. Can you see? Just confirm that you can see this.
Yeah, women's health, yeah.
Yeah. So as I said, I'm just covering the general. So before I start my presentation, I'm going to do a little chant. So it's just a small chant. So if you're familiar with the chant, you can sing, or you just take a deep breath and listen to the chant. And hopefully at the end of our webinar, we will feel this like this little flower bud and growing through vibrant colors, and how the changes are happening there. That's how I see a woman life, okay, around the cycle. Okay, so I'm gonna do my chant. So everybody take a deep breath and just listen. Ya Devi Sarvabhuteshu Shanti Rupen Sanstita. Ya Devi Sarvabhuteshu Shakti Rupen Sanstita. Ya Devi Sarvabhuteshu Matra Rupen Sanstita. Ya Devi Sarvabhuteshu Buddhi Rupena Sanstita. Namastaste, 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 namo namah. I bow to the Mother Divine, which is established in all of us in the form of peace, strength, wisdom, and healing power. So Mother Divine has given us all of the powers, and that's all within us. And I bow all the power within all of this, all in me and all in you. So Jai Ma, Jai Mother Divine. So in the Ayurveda, for the menstrual cycle is the balance of Ayurvedic physiology of the menstrual cycle is controlled by the quality of the digestive fire and the three doshas. I'm presuming that all of the audience is familiar with the Vata, Pitta, and Kapha. If you're not familiar, I would say you go to the website and fill the questionnaire and find out your body type, because it's very important that you know your body type, because all the advices and all the imbalances are according to what is your dominancy. So Ayurveda is based on the principle of your unique body type. So the balance of your body type, which is Vata, Pitta, and Kapha, and how strong is the digestive fire, that decide the quality of your monthly cycle. So I'm not going in detail about the digestive fire. There's a whole kind of clarification and kind of elaboration on the digestive fire. We have covered that in our previous webinars, and I think Dr. Brennan is going to touch a little bit on that. So I'm just kind of moving forward from here. So according to the Vata, Pitta, and Kapha, most of the problems that are in the woman's cycle are dominantly Vata imbalance, because Vata is the movement. Anything that moves in the body is because of the air element. So Vata is the movement, and the downward flow of the blood and the bowel and everything is controlled by the air in the body, and air is called Vata. So also Vata regulates the nervous system. So a calm, balanced nervous system is very important for a smooth, balanced cycle. And Vata is responsible for much of the nourishment of the rasa. So just touching the what is rasa, when we eat the food and food digests properly, there are two things are formed from the food, which is rasa, the good quality of the end product of the digestion, or ama, which is the toxins formed by not digesting the food properly. Dr. Nahid is going to touch a little bit on ama. So I'm just going to say rasa is the good end product of the good digestion. And from the rasa, all the different layer of tissues are formed. So a raja, which is the menstrual blood, is formed from the good digestion. If digestion is working well, the quality of the menstrual blood will be good and the quality of the cycle will be good. So make sure your digestive system is working well. And then, so the vata is responsible for the nourishment of the rasa tissue and the quality of the menstrual flow. So excess vata, if vata is increased in the body, vata could increase in the body because of two reasons. Either the person is eating too much of vata food, which increases vata, or vata is blocked in the body due to some reasons. There could be too much of kapha, which is blocking the downward flow of vata, and it is increasing vata, and that is causing problems. So excess vata can dry the plasma and the cause of the issues around the cycle. So too much of air, and the too much of air is drying up the tissues, and that are causing the different problems around the cycle. So if vata is out of balance, so first you might be a vata person, you may not be a vata dominant person, but if you have vata imbalance going on in your body, so what's going to happen? You might have amenorrhea, might have cramps, very painful cycle, pain radiating down into the groin region, thighs, lower back. Cycle could be irregular. Sometimes the clients say they're 28, 35, 40-day cycle, and stiffness in the body. Depression, mood changes are very common around the PMT. And then the insomnia, weakness, and the dryness, bloating, constipation, and the craving for the sweets and chocolates. We all are familiar with these symptoms. So that is happening because of the vata imbalance. So if vata balance is not corrected on time, it leads to endometriosis, very bad PMS symptoms, dysmenorrhea and amenorrhea. Dysmenorrhea is painful and heavy bleeding cycle, and amenorrhea is a no cycle. Some women, all of a sudden, they are not having any periods, and that could be because of many different reasons. But in Ayurvedic way, amenorrhea, we look at it as increased vata in the system. So I was talking about the apana vata. So just in this slide, just going to touch a little bit on the 5 subtypes of vata. When the Ayurveda practitioner talk about vata, vata is a very broad term. It's like air, but air is performing different functions in the body. So in the Ayurvedic text, vata is divided into 5 subtypes. So the first one is prana, udana, vayana, samana, and the apana. So the 5th one is apana, which is more important for the menstrual cycle. So apana is the downward flow of the air. Anything that is moving down, like the elimination of urine, feces, fetus, blood, semen, all is controlled by the apana. Sometimes due to some reasons, like person is doing too much of exercise, too much of cycling, too much of running, this downward flow of vata get disturbed. Or as I said earlier, because of too much of a kapha or cyst, the vata cannot flow in its natural way. So that imbalance is causing the problem. So apana vata is responsible for the menstrual flow, and it has a direct effect on the cycle. So any issue related to the cycle, the first Ayurveda practitioner will try to correct the apana vata. So then we have a preparation like apana balance. So that's what the meaning of apana is. If you're listening to the word somewhere else, apana. So that is one of the type of the air of the vata, and related to the cycle, we just focus is just to imbalance the apana in the body. And in Ayurveda, in general, when we talk about the balance, what is the meaning of balance? In the different tradition, there are different kind of pillars of health. Some people call it diet, and the 3 different pillars in Ayurveda are considered for the balance. So ahara, which is the diet, and it could the lifestyle as well, ahara and vihara. And anidra is sleep is very important, how much sleep a person take. Nowadays, we go to bed very late, we get up late, so that disturbs the physiology. Sleep sleep has an effect on the physiology and the type of food you eat. If you're eating too much of light, cold food, too much of heavy food, it's having an effect on the vata and pitta and kapha. And according to the diet, the imbalance is created in the body. And how much exercise we are doing is also very important. Exercise is part of the balance, but exercise should be done in the moderation. I see in my practice a lot of the young girls doing too much exercise. And when I ask them to stop doing exercise, take a bit more rest, and by doing less exercise in moderation, they correct the vata imbalance, and sometimes the cycle just come back. And the brahmacharya is the self-control. So self-control around so many different factors. So it is like celibacy, how much sexual power you use, and around how far you go, how much you do, like the mental issue and all that has an effect on the cycle as well. So when we look at the balance, we are looking at these four things: diet, sleep, exercise, and the mental health. So that will be the Ayurveda practitioner will be working on when you have any imbalance happening in your cycle. So what we will do, what you can do to help yourself if you have painful periods or you are feeling you have vata imbalance. So the general advice that you can do yourself at home to help with these issues is you take a teaspoon of castor oil and you can mix it with trikatu powder. Trikatu is a combination of 3 herbs, which is ginger powder, black pepper powder, and long pepper powder. So you just take a quarter teaspoon of trikatu, mix with a teaspoon of castor oil, and you can take it from the day of ovulation until you have the cycle. And taking it for 3 cycles, it definitely reduces the pain. So you will have a pain-free periods after the 3 months. You might need to continue for longer if you're still experiencing the painful periods. And then aloe vera juice is very good to balance the pitta in the body. So and stimulating the liver so the toxins can easily find their way out. When the cycle happen, when the menstrual cycle happen, lots of girls experience acne and too much of heat in the body, and hot flushes kind of later on in the menopause. Even during the cycle, the mood swings and anxiety is very common, and that is to do with the liver. So if we look into the acne and all of that related to the cycle, so the general advice is to stimulate your livers, and aloe vera juice is very helpful to balance the liver energy. And the Chyawanprash is another natural source of vitamin C and antioxidant, and healthy fats are very important in your diet. So having a good oily fish or having omega oils in your diet, krill oil in your diet is very good for the cycle. And advice around the food here will be, if you are having painful periods, and mood swings and sugar craving and all of that, you start eating light. So start eating light either 7 days or 3 days before your cycle. And when people say, what should I eat? The khichdi is a wonderful food. So khichdi is a rice and dal and vegetable. So we have given the recipe of the khichdi before. It's easily available. So you start eating khichdi 3 days before the cycle, and you continue for the next 2 days of the cycle as well. So eat light and drink plenty of warm food. Dr. Nahid is giving CCFT recipe. So that CCFT is also very beneficial to drink during the cycle. So self-massage throughout the month, very important to do the performing self-massage for your body to balance the vata. And ginger, fennel, ajwain tea. I would advise lots of people, lots of girls are go to the GP with these problems, and the GP advise them to take hormonal pills. If possible, avoid the hormonal pills because that creates a lot of imbalance in the physiology. But if it's necessary, of course, you need to discuss that with your practitioner. But in general, it is advised because not to have more disturbance in your hormones. Ajwain and cumin is very beneficial to Yeah, sorry, I was muted. So, the ginger, ajwain, and cumin tea is very beneficial to deal with the cramps and the pains and the mood swings and all that. Ajwain is a wonderful, wonderful herbs because around the cycle, the person could experience nausea, person could experience constipation, and those things happen. So for constipation, for nausea, and for cramps, ajwain, you can take either a seeds or just swallow them or make a tea with them. And then regular gentle stretch. If you're doing spinning, high intense exercises, any of those, I would advise to stop and perform gentle yoga exercise, go for gentle walk, gentle cycling. So exercises in moderation. And practice silence, because Vata people tend to talk too much, and sometimes too much talking could cause the disturbance in the Apana Vata as well. So practice silence, especially around the cycle, around the bleeding phase, and go inward and do self-reflection and practice a lot of positive thoughts, a lot of self-love, and a lot of self-care around the phase, the bleeding phase of the cycle. And all the tradition, women used to rest for 4 or 5 days. They used to go in a separate room, separate kind of a room in the house, and they wouldn't engage in the house chores and anything. These days it's not practical. We all have to work, but if possible, for the first day of your cycle, take it easy and not do any heavy exercise, any heavy work in the house. Don't hesitate to ask for help, ask for support, ask for your family members to help you with the house chores and other activities. And also, I would like to say the cycle for a woman is a wonderful way. It's a kind of a bonus for women, because around the cycle, our body detox. So we should use this opportunity. We should assist the process so that the body can get detoxed during the monthly 3 or 4 days. And during this period in general as well, if possible, use less stimulant, coffee and alcohol and chocolates. They should be used less, and don't suppress your natural urges, urge to go to toilet, urge to pee and hiccup and burp, any of those. Don't suppress any of those kind of natural call of the body. And avoid exposure to the cold weather, especially now, the autumn time of the year, too much wind, too much cold. Wrap up yourself properly and don't expose yourself directly to the cold weather. And in the Ayurveda, Abhyanga, the massage, steaming, and their basti, some kind of very nourishing procedures are done to balance the Vata in the body. Sorry. Okay, and then the Pitta. So that was the Vata. So I'm not going into details of the disease or the problems like amenorrhea and PMT. The advice for mostly will be the same to balance the Vata. And then the Pitta is the fire element, and fire is for the transformation. So the role of the Pitta in the cycle is the transformation of food into the hormone, regulate the hormones in the body, the level of estrogen, progesterone, FSH, LH, all these hormones levels are controlled by the Pitta. So the Pitta imbalance will be very heavy blood flow, bloating, and intercycle spotting, and frequent periods, smell, and irritability and anxiety on the emotional level. And the disease will be related to Pitta, PID, all the inflammatory disease, endometriosis, menorrhagia, metrorrhagia, fibroid. So all these cycles, all these issues are because of the Pitta. Pitta is inflammation. If Pitta is too much in the body, that's going to cause inflammation. And because of the inflammation into the womb, into the uterus, because of the disturbed Pitta, these problems are going to appear. So the treatment is for the Pitta imbalance. If the woman is very Pitta dominant and you doubt there is a Pitta imbalance in the system, so the first to correct is in the Vata, it was to correct the Apana Vata. And in the case of Pitta, it is to correct the liver. So we have to work on the liver, detox the liver, because liver is responsible for formation of the Ranjika Pitta. So that is one of the subtype of the Pitta. So Ranjika Pitta is the quality of blood. So through liver, blood tissues are formed. So if liver is working properly, a proper blood tissues are formed, less ama in the blood, and better cycle. So to detox the liver, what herbs are more beneficial, like in general from your kitchen? Hibiscus, rose petal, and licorice tea. You can make a tea from the hibiscus rose petal, and that help with the anxiety, and that help to calm down the inflammation in the body. And then some other herbs which you may not be familiar, there are Ayurvedic terms for the herbs like Sariva and Musta and Shatavari and Manjishta. They're wonderful herb for Pitta imbalance. And also because Pitta is the cooling. Pitta need the cooling energy. So walking under the moon or doing the moon meditation is very beneficial for Pitta women. And wearing the pearl necklace or the pearl earrings will naturally help to calm down the Pitta in the body. And over the couple of the months, you will feel yourself more calm, less anxious, and your cycle is less angry, and you get less acne and all that. So this general recommendation. And then have fun. Pitta people are over ambitious. Pitta women could be work alcoholic, trying to do too much, trying to fit too many things in a day. So have some fun, add music, add dance into your once a week or at least once a month. So have fun and chill out. And Shirodhara treatment with pitta pacifying oil or buttermilk is very help to calm down the mind. And when the mind is calm, digestive system works properly. And when digestion is working properly, the pitta is more in under control. So the Shirodhara is a kind of a Ayurveda treatment where the warm oil or lukewarm herb decoction made with buttermilk and all that is poured on the forehead. So that is it. That will be the Ayurveda Panchkarma treatment around the pitta. And the kapha, everybody knows kapha is stability, kapha is the structure, and kapha is the growth. So any kind of growth happening in the body, the mucous membrane, the lubrication in the mucous membrane, all that is because of the kapha element. So if kapha is too much, what will happen? Sticky substance will be secreted too much. And because of the sticky substance, mucus lining start getting thickened, cyst will start forming, endometrious lining will be thickened. So endometriosis is PCOD, PCOS, all these problems are related to kapha. So heavy bleeding, any kind of growth is because of the kapha imbalance in the body. So if you recognize yourself a kapha woman, so you try to balance the kapha through your diet, through your lifestyle, and using stimulating spices like turmeric, ginger, black pepper, cinnamon, and you massage with warm and stimulating oil. So warm and stimulating oil will be mustard oil, sesame seed oil, ginger essential oil. And if you have like some kind of cyst in in the uterus in the womb, so I recommend using a kind of a lapna to do a kind of a lap with the mustard seed paste, and you can add some ginger powder in it. So you make kind of a pack with it, and you apply that, mix it with the castor oil, and apply it on your tummy. So mustard seeds, you can make a paste from it and add dry ginger powder and mix it with castor oil and apply on the tummy. So again, from the ovulation until the periods, and this will slowly help to dissolve the cyst and especially help with the heavy bleeding and the clotting and all of that. And for kapha women, they should avoid sleeping during the daytime, especially sleeping, eating after the food. In a lot of tradition, in a lot of the countries like India, especially in the summertime, there's a tradition to sleep in the middle of the day. So kapha women should avoid that. And avoid heavy dairy product for kapha, and ama clearing diet. So ama clearing diet will be the khichdi is one, CCFT is another one, and then the soup, light soup made from the herbs and all these spices. And the castor oil pack, there's all different videos available how to do the castor oil pack. And then fast for kapha people, kapha women, if possible, try to fast once per week. So for the fasting, you just eat a very liquid soup or just vegetable broth or something like that. Okay, so I'm touching a little bit on the endometriosis because somebody asked in the class last week, I will be talking about the endometriosis. So endometriosis is the thick lining. So the naturally uterus prepare itself for the implantation of the embryo. So that's the womb base. So for every cycle with the balance of hormones, a thin lining is formed and implantation of the embryo doesn't happen, ovum doesn't get fertilized, it is shredded, and that's the cycle. Due to some reason, and that reason could be vata, pitta, and kapha imbalance. As I said, linings start getting thickened and vata start getting obstructed, and the kapha increase the thickness in the endometriosis lining, and that is the problem where the lining is getting thickened and thickened and thickened, and to pass the lining there will be pain, there will be heavy bleeding, and sometimes this lining doesn't grow in the uterus, it start growing in the nearby. It could grow over the intestine, it can grow outside the uterus, and it doesn't have a way to get out, and that is causing a lot of trouble during the cycle. So general symptom will be pain in the uterus, lower back pain, pelvic cavity, and repeated miscarriage and infertility. That could be a reason for the infertility as well. And painful urination, frequent UTI, and excessive bleeding. And if kapha is involved in it, and the adenomyosis could happen as well. So if there is involvement of kapha with the endometriosis. And then the causes, normal causes, don't know what caused the endometriosis. It is the hormonal imbalance. Sometimes the high estrogen levels are responsible for the endometriosis, high estrogen. And then women who are miscarriages are happening again and again. That can also lead to endometriosis. and some environmental factor, caffeine stimulating diet and all that. Diet in Ayurveda, Vata, Pitta, Kapha will be the responsible, depending on the what is the imbalance, what is the person's basic nature, and what is the imbalance there. According to that, we can find out the reason for the endometriosis and we can treat it accordingly. So the general advice for the treatment for endometriosis, what I'll give is, as I said, Vata, the drying nature of Vata, that will dry up the lining, and the inflammatory nature of Pitta will lead to more inflammation, will lead to bleeding, and will thicken the lining, and the mucus, the heavy nature of Kapha, will keep on thickening the lining, and that will be causing the havoc around the endometriosis. And so the treatment protocol for a practitioner will be, you relax the uterine muscle. So we have natural uterine tonics and natural antispasmodics like Ashoka. Ashoka is one of the herb. And the second protocol will be to increase the blood flow so that we can move the toxin, we can shift the ama as soon as possible through the monthly cycle. So the herbs to increase the blood flow will be Jatamansi and Musta, and reduce the prostaglandin inflammation. So what is involved here? Liver is involved here in the inflammation. So some anti-inflammatory herb like Boswellia, Punarnava, there are so many. I'm just only giving out one or two basic ones and more kind of specific ones, and then regulate the hormonal balance of the relative estrogen excess and the progesterone deficiency by using herbs like MA631. MA631 is a very, very good, interesting herbs. It is called Meda, and it is to regulate the digestive fire, to regulate the digestive fire of the tissues, for tissues like rasa, blood, muscle, and all of the different 7 layers of the 3 tissues in the body. So MA631 have to correct the digestion around the tissues, so the tissues are forming properly, and through forming the tissue properly, the lining start forming properly as well. And enhance the liver functioning with the formula like liver care, MA579, and insulin resistance is also involved here. So I'm not going in depth what is insulin resistance and all that. It is for the women who are taking too much of sugar or too much of bread or too much of refined grains. Insulin resistance can easily, may not be diabetic, but it could be a pre-diabetic condition, and the obesity. So that lead to kapha imbalance, and insulin resistance is a big factor for endometriosis, PCOS, and all of that. So look into your sugar, correcting your sugar balance and intake of sugar and all of that. An anti-vata treatment, I have already gone into detail about the vata. So around the diet, herbs and oils, so a lot of different herbs and oils for the vata and balancing, and the panchkarma treatments. So around the panchkarma treatments, there are shamana and shodhana treatments. So a lot of kind of purification, nourishment, and all those treatments are there. So so I want to give these very kind of specific yoga asanas around the periods. There are so many different asanas, so I just picked 2 yoga asanas and 2 pranayam, the breathing exercise, which help with the PMT and PCOS and all of that. So most of you must be familiar with the cat and cow. So with the cat, it is energizing the spine energy, and by energizing the spine energy, you energize the blood flow to the uterus, and you kind of have a better quality of the cycle by doing these yoga asanas. So this is cat and cow, and the butterflies is also moving the blood flow around the pelvic area, especially through the all of the arteries that supply to the uterus. So, and then there are other asanas like baby pose and inverted spine asanas and all of that. But if you're not familiar, you're not doing yoga posture, just doing these 2 yoga posture also help to deal with some of these PMT and some of the problems around the cycle, because these help to flow the apana properly in the downward direction as well. And you're looking at Kapalabhati pranayam here. Kapalabhati is forceful exhalation. So if you look at the picture and you look at the abdomen, how the abdominal muscles is going like a flap, and you are just exhaling, and you let your abdominal muscle flap in and out. And through by flapping the abdominal muscles, you're regulating the apana, the downward flow of the air, and you regulate your digestive fire, you stimulate your digestive enzyme, and you stimulate your liver. And then the Nadi Shuddhi Pranayam. So some of the yoga people here will know that there's a male and the female energy flowing through both of the nostrils. So some issues related to the cycle could be emotional issues related to the male and female energies and all of that, or just some mind imbalances. So just a quick way to correct those imbalances are Nadi Shuddhi Pranayam, where you inhale through one nostril and you exhale through the other. So you use the mudra. So that is the mudra. And you use 2 fingers and you use your thumb. You go one nostril, you close with your thumb and use 2 fingers to the close. So that's the way you do the proper Nadi Shuddhi Pranayam. Okay. And so this is very interesting one. Might be new concept for a lot of people here, the Yoni Mudra. So Yoni is a woman genital areas, and this is the mudra. This is what is practiced to energize the energy around the uterus and around the lower part of the body, around the reproductive organs. So this mudra is like bringing your hands together, and then you let your thumb go in upward, and then your fingers go down, and you bring these fingers in between, and you can put this around the 4 fingers below the umbilicus, 4 fingers below the belly button. So if you find in the first picture, if you find it complicated to do, you can follow the second picture where you just put your hands like that under the belly button, and then the chakra, the solar and the chakra, the flow of energy, all the different arteries and all of that. In Ayurveda term, we call them chakra, is the Swadhisthana chakra. This is the second chakra, which is responsible for the creativity of new life, for joy, for fertility, and for the grounding quality. So this chakra, we want to activate this chakra. So you put this your hands like that on your womb, and then you kind of visualize the orange color, because the chakra is orange in color. You can wear orange color clothes as well. And the mantra for the chakra is Om. So it is Om mantra. So you can meditate like Om, and by putting the hands on the mudra. So through that, you can activate a lot of energy in the womb, and you can correct a lot of these imbalances by practicing this little kind of technique of yoga. And then there are a lot of herbs, and just talking a few herbs here. Shatavari, ashwagandha, and jatamansi to deal with the hormonal imbalance. Jatamansi is wonderful for progesterone. Shatavari is wonderful estrogen, and ashwagandha is kind of also kind of regulate the hormones, but it's meant to calm the nervous system. And then Trikatu and Punarnava. Trikatu and Punarnava is very beneficial for the women who feel fluid retention, bloating, breast tenderness, and some women feel very heavy around their cycle, and they feel there's a lot of fluid in the body. So Trikatu and Punarnava with the aloe vera juice will deal with that. And Apana balance for the downward flow of the Vata, PMT, and painful periods and all of that. Liver care for Pitta, and blissful joy if you feel very anxious and mood swings and a lot of mind issues are happening around the cycle. And the Ashokarishta. Ashokarishta is a liquid form, as I was saying about the antispasmodic herb Ashoka. So Ashokarishta in India is used very widely. Even the medical doctors also advise Ashokarishta very freely. It's very well known liquid for women problems in India. So it is the best. That's why it's called the best friend for women's health. So it's just a liquid form, a tablespoon into warm water around 7 days before the cycle and during the cycle, and then you stop it. But if you have an ongoing problem, then you continue throughout the cycle. And the other supplement I would like to bring your attention to is iron. A lot of women could be very deficient in the iron, and because of the iron deficiency, a lot of issues could happen. So look for a good quality iron. In our preparation, we have MA600, which is iron support. That provide little iron, but it actually help the absorption of iron in the body. Or you're looking for a more plant-based form of the iron, okay? Because the other ones, constipation and all those issues related on the iron. So sometimes iron deficiency doesn't show up in your blood test, but if you feel issue around your cycle, and do worth considering taking a bit of iron as well. So these are some of the basic herbs. So I know from the practice, a lot of girls ask about what to do with their sugar cravings. They crave for chocolate, or they crave for like comfort food and all of that. So we have given this recipe in the notes. And this is a saffron rice cooked with the rose petal and the coconut and cardamom. And it's a very nourishing, very tasty kind of a sweet dish. And for providing the sweetness, I have recommended to use jaggery. And jaggery is a raw sugar cane, like molasses, natural form of iron, natural form of a lot of microminerals. And it's a slow release of sugar, so it wouldn't be as harmful as taking the sugar. And then if you put saffron is a wonderful herb for women as well. And so this is a very nice kind of a little recipe to deal with the cravings. So other quick things, you can use dates and macadamia. You can blend the macadamia nuts and dates together and make a little balls with them. Oats milk blended with some dates or vanilla or something like that, or homemade flapjacks with ghee or jaggery. So you can easily find very nice recipe to deal with the cravings rather than opting for chocolate or opting for cakes, which is going to increase more caffeine in the body and increase the problem. So you're not dealing with the problem. So try to deal with the root cause of the problem. And when you're dealing with the root cause of the problem, you're able to deal the other secondary symptom associated with the cycle. Okay. So I think that's it from my side. Thank you very much. Thank you so much for listening. And I hope I wasn't too fast. So thanks a lot. Thank you. So I hand it back to Noel. Thanks.
Okay, Raj, so if you just stop the share on your screen.
Yeah.
Okay, great, fantastic. So huge amount of knowledge in there, huge amount of knowledge. So as I say, we can watch back over this, and also a lot of this will be in the notes. I mean, there's a lot of talk about different herbs that can be used there, and maybe people will relate, you know, different things to the conditions that they have as well, you know. So Dr. Brennan, let me just unmute you. So hi, Don, just say something there.
I know.
Okay, you're on. Okay, so I think all of you know Dr. Brennan. Dr. Brennan is a medical doctor, but has worked in the field of Ayurveda for must be nearly 30 years, over 30 years at this stage. He's the founding president of the Ayurvedic Practitioners Association in the UK and has consulted with thousands upon thousands of people over the years. So Dr. Brennan, I'm very happy to let you go ahead and make your presentation.
Thank you very much, Noel, and thank you, Rajvinder. You've almost done all my work for me. I'm going to talk about perfect health, fertility, pregnancy, and progeny. And after a few introductory remarks, what I hope to do is just to give the suggestions that help for conception, and moving on from conception to talk about fertility generally, and perhaps looking at it from a more medical perspective, to make a point that it's essential that ladies understand their physiologies to take a best advantage of conception. And then talk a little bit about infertility, a few words about pregnancy. So as introductory remarks, we're after perfect health, and for that you need to be an expert in your own health. And therefore Ayurveda means knowledge of life, taking knowledge from every direction to become that expert, so you know how to restore balance to your mind, your body, your emotions. And ultimately what Maharishi Ayurveda offers is a reawakening of the biological intelligence at the deepest level of your mind-body. We want to do this particularly in relation to fertility and progeny, because healing your own system and deepening your health and happiness will increase your fertility, and more significantly, when you are interested in conceiving, in giving you really healthy progeny. So we start Maharishi Ayurveda with consciousness, because at the deepest level, there is, beyond your finest thought and beyond the subtlest biological intelligence at the basis of your whole system, is that awareness or consciousness, that inner being, the one who has your thoughts, that source of all life and all intelligence and all energy at the deepest level, that actually starts to reverberate, to become lively and active in generating this mind-body. And so that consciousness flows as this biological intelligence, which is within the DNA in every cell, then motivating and mobilizing the expression of all the appropriate functions and structures for good health and for fertility. And this inner source, actually, in all the ancient goddess traditions, should we call them, this consciousness within you at the depths is the sacred heart of the goddess tradition, the sacred heart of your power and your femininity. And so the way in Maharishi Ayurveda, we like to start awakening on that deepest level of pure consciousness is the technique of transcendental meditation, which then brings balance from that level to all subsequent levels. The next level up from that deepest level is the finest feeling level. And this is where you must learn to be very loving, especially to yourself. So you want to actually heal yourself, which is a self-nurturance. You want to, on the level of feeling, deal with your own physiology as you hope to deal with your new progeny, the baby. The baby's tired, you'll give it sleep. If the baby's hungry, you'll give it food. You must deal with your physiology with the same degree of compassion, gentleness, kindness, nurturance, and love. And on the level of your mind, which is a little bit more superficial in your thinking, then you need integrity. You need integrity in terms of how Ayurveda would suggest. Hita is what you do for the good and benefit of the life of others and for the happiness of others. And Shuka, doing what is good for your own individual physiology and your own health and joy. So this is the expression of love on an active mental level that then, with these internal mechanisms in place, starts to generate physical well-being and health. And remember, conception is a great expression of the great love between you and your partner, and it's the driving force for nourishing the child for life. So you better start learning to love now with loving yourself for the sake of the child to come. So in the principles of Ayurveda, Raj was very nicely described Vata, Pitta, Kapha, the significance of the digestion. And digestion is not just the foods, it's of all your experience, all your thoughts, your emotions, your perceptions, your experience from the outside world. All of this you will digest and transform into your mind, your emotions, and your physiology. But in relation to the body, Raj mentioned the tissues, the tissue elements like rasa, the uterine fluid, rakta, the blood, and particularly shukra is the seventh and the most fundamental of our tissue elements, which nourishes our reproductive tissues, which nourishes the DNA to reproduce in every cell, but also our reproduction in terms of progeny. That being the end of the line in the nourishing cascade through all the tissues, you need to specifically focus on nourishing Shukra when you're interested in conception. There's also channels or shrotas in Ayurveda, 13 for men and women, but 2 extra for women. One is the reproductive tissues of women is considered an extra tissue, but this in subtle values is the tissue of creative capacity. It's the woman who creates. It's a power of Shakti passed down through the female lineage, the power of creation, an element of a woman's contribution to life, which, is, basic. And the other is the channels to the breast, which are indicative of the reality that is the ladies, that is nourishing to our society and our culture. And so these extra tissues in Ayurveda are considered as well. Ultimately, Ayurveda talks about ojas, and ojas is that finest essence, which will it will energize, integrate, and enhance the whole flow of life in terms of joy. And this ojas is the outcome of the balanced digestion metabolism, creating the very healthiest of tissue, and ultimately that which will make you most fertile. So you need a strong, healthy shukra, you need abundant ojas, and you need to start planning for conception well in advance. So to prepare for conception, Ayurveda would suggest, first of all, a consultation with an Ayurvedic practitioner to ensure that you're individual needs, your individual health needs are being addressed to your unique situation. Then Ayurveda would consider practicing the transcendental meditation. The next fundamental would be, if at all possible, to do panchakarma, which are deep detoxing treatments from Ayurveda that remove toxins which block the flow of intelligence and function. And so the panchakarma would then empower the nourishing of your tissues through clearer channels, through foods and through tonics. Now, there's this concept in Ayurveda of rasayana, because we have tonics or herbs that are healing to the body and balancing, but there are other herbs which are tonics. And Rajvinder has also mentioned these, like shatavari, aloe vera, gakshura, ashwagandha, the strengthening. Now, subsequent to that strengthening comes the specific Vajikarana treatments. Vajikarana is one of the 8 branches of Ayurveda, and it's to do with creating healthy progeny and to do with the strengthening conception. So the next thing we would then think about is the diet. We want a nourishing diet. There are phytoestrogen containing foods. These are brilliant. There are foods that contain phytoestrogens. They have estrogen-like effect, but a weak estrogen-like effect. So if you're producing too much estrogen and you're eating these foods will sit on the receptors. These phytoestrogens will sit on the receptors for estrogen and block the excess estrogen from functioning. But on the other hand, if you're not creating enough estrogen, these foods, because the phytoestrogen have an estrogen effect, they will actually support your estrogen in that situation. So such foods would be the grains, the whole grains, the legumes, the seeds, flax seeds, sunflower seeds, pumpkin seeds, sesame seeds, and nuts. Okay, but as well as these phytoestrogen containing foods, as Dr. Rajvinder mentioned, the essential fatty acids you should have. And not to take foods like alcohol, trans fat, polyunsaturated fats, coffee. The next thing to think about is a healthy routine, early to bed, early to rise, good long hours sleep, 8 to 9 hours. But be aware that your bedroom should be dark, because even flickering lights from your computer or your mobile phone or your clock, that light goes through your eyelids, and even as you sleep, it impacts your pineal gland, which is creating melatonin, your sleep hormone, but that impacts your hypothalamus then and can disrupt the menstrual flow. So a dark room. Also now, the oil massage that Dr. Rajvinder mentioned is specifically good for a Panavata that Dr. Rajvinder was mentioning. Exercise you enjoy according to your strength, and then you must think about your mental and emotional health when you're considering conception. And if needs be, get assistance there, because sometimes inherited negative attitudes interfere with self-esteem and create anxiety about reproduction and fertility. That should be cleared. So you're left with a cultivating, loving, nurturing situation, and nurturing relationships, as Rajvinder showed, to allow you to unfurl your petals and shine like the goddess you are. You want a happy, stable relationship for preparing for conception, obviously. Perform regular creative practices to liberate your inner inspiration, like music, art, cooking. And then moderate sexual activity, because excessive will deplete the shukra, the reproductive elements. Obviously, avoid mental and emotional stress. It affects your hormones and even your cervical fluid. The perfect weight would be ideal, because if you're too thin, the body fat also creates estrogen and tops it up. There's not enough. It can lead to amenorrhea and other complaints. But also, if you're too fat, the excess hormones of estrogen produced disturb the normal cycle. So aim for an ideal weight. Ensure good thyroid function, because the thyroid is important for your fertility. Avoid harmful substances. Now, we're not just talking about alcohol, cigarettes, and various drugs. We're thinking here about parabens. And they disrupt your hormones. They're to be found in makeup, shampoo, foods, beverages. Look at the label, right? And then also be aware that phytolates in flexible plastics in which your vegetables from the supermarket are wrapped, these phytolates can interfere with your cycle. A simple practical strategy is no douches, sprays, or scented tampons, because they'll alter the normal pH in the vagina and the poor sperm has no hope. And then the lubricant which would be useful would be pre-seed, PRE-SWD. If you need a lubricant during intercourse, that's the only one. Why? Because the others disrupt the poor semen. You want a welcoming environment, so you want one that has the right pH balance and that is nourishing to the semen. Pre-seed. So we talked about panchakarma to clear the toxins, and then we were thinking about the nourishment. A few more words about that milk, ghee, almonds, fresh fruit and vegetables, whole grains. How often will we repeat it? But these are the foods that are good, and eliminate junk food, meat, alcohol, and caffeine. The Harvard nurses study of 18,000 ladies over 8 years, which foods improve fertility, and if the cycles are irregular, they say avoid the trans fats and the use unsaturated vegetable oils. They said increase your vegetable protein and choose slowly digested carbs, which are complex carbohydrates. Leaving out the refined grains that Dr. Rajvinder was talking about. Get plenty of iron, as you said, from plants, particularly like whole grain cereals, spinach, beetroot, beans, pumpkins, tomatoes. Drink a lot of water to stay hydrated. Take a multivitamin, at least 800 to 1,000 micrograms of folic acid per day, because you need that in the first trimester to prevent baby getting problems with their spinal cord, the spina bifida. And then Ayurveda would have lots of suggestions about the foods that are really nourishing and promotive for conception, like the dairy, the nuts, the beetroot, the sweet potato, the almonds, the apples, pears, garlic. But avoid linseeds, avoid mustard seeds and pepper, really, not so good for the reproductive. And avoid all the rubbish foods, obviously. A good tonic drink, so long as you don't have any blood pressure tablets, add a teaspoonful of licorice root to a cup of boiled milk with cardamom, ginger, a little sugar. That's a very nourishing drink. Or, again, I read it, Rajvinder talked about the dates. If you stew 3 or 4 dates and blend them, add a cup of boiled milk, cardamom, saffron, and then blend a lot again, it is yummy. What a lovely way to nourish yourself. And when we talk about Rasayana tonic herbals, we know about the Amrit Kalash. These are tonics, very good general tonics. Rajvinder also mentioned Chyawanprash. There's a ladies' tonic called a ladies' Rasayana and a men's tonic called men's Rasayana. So as well as these Rasayanas, there's Vajikarna herbs, aphrodisiac also. They nourish the reproductive organs. They increase the desire for reproduction, as well as strengthening yourself for the purpose of conception and for the child to come. The best Vajikarna, love. And then the foods we were talking about and the herbs we're talking about, and then more of the herbs like the Shatavari, Ashwagandha, Shilajit, the licorice we mentioned, Gokshura, Vika. Then there are Maharishi Ayurveda products like the Smooth Cycle and the Vital Woman, or the Fertility Plus Men or the Vital Men, or the Ashwagandha Indian Asparagus Complex, or MA3323, MA3325. Best that you have a consultation to establish which of these are better for you. Now to talk about the interesting topic of fertility for the man, first of all. Fertile from puberty till he dies. You have to put him into a coffin to stop him. He's always fertile. Up to 1 million semen per day he's producing. But these require about 3 months to mature. And so this is why it takes time and we plan ahead for conception. Up to 700 million sperm he'll deposit on his ejaculation, and the majority in the first MILF is ejaculate. But these are nourished by fluids from his prostate and from his seminal vesicle to give the right pH and to give energy to the semen as it's being deposited into the vagina. But on arrival in the vagina, is he welcome or is he not? Well, if it's fertile time, the ladies will be producing a cervical fluid which will provide the right pH and the right nourishment, and the semen can thrive. And this fluid has been called by some the ladder to heaven. But if it's not the right fertile time, the semen is not got much of a hope. Now we think about the lady's fertility, and we think about the moon, because this natural cycle, 28-day cycle. And so at new moon, a lady should really, if she's very well attuned, be ovulating. At full moon, then she should be, she'll be having her period at new moon and ovulating at the full moon. In the cycle, the initial portion, the first half of the cycle before ovulation, is the kapha phase. The pitta phase is after ovulation until period, and then of course vata takes care of the period. It's a wonderful, complex symphony that every lady should be aware of that's going on in her physiology to fulfill her role of creation. The hormones, the structures. But if we go through them, the master controller is up in the hypothalamus. And here, the hypothalamus is very close to the limbic system at the lower portion of the brain, which is why the emotion is so influential to the whole lady cycle. But the hypothalamus and the pituitary comes down from a stalk hanging from the hypothalamus, and the pituitary and produces all the stimulating hormones to get all the hormonal system in the body, all the various organs working. So the hypothalamus produces what are called gonadotropins, which go down to the pituitary, and then the pituitary is stimulated to release its hormones. Its hormones are basically follicle stimulating hormone in the first half of the cycle, luteinizing hormone in the second. These immediately impact on the ovaries. Now here, a lady, strangely enough, is not as fertile in the same way as a man. A lady is born already with all the eggs in her ovaries she will ever need. Tens of thousands of eggs. And interestingly, I find this fascinating. They were there when she was in her mother's womb. And when you think back, you think that's fascinating. Your grandmother bore you. Your maternal grandmother actually carried the egg that would be fertilized to create you. In the same way as you, if you've had a daughter, carried the egg that will produce your granddaughter. I think that's a fascination. Anyway, the eggs are there, but they're ready to go with the follicle stimulating hormone coming down from the pituitary. 10 to 20 eggs will start to mature, and the race is on, because the survival of the fittest, it's only the fittest that will come to maturity and ovulate. All of this now is stimulating this follicle that's developing to produce estrogen. The estrogen that's being produced is impacting on the womb, which is now increasing its lining and getting ready for implantation of a fertilized egg, and starts to alter the cervical fluid. The fluid that's coming from the cervix is the lower part of the uterus that protrudes into the vagina.
Raj wants to see if you use the slides.
No. Thanks, Raj. So I just got a message from Raj there. She's telling me to put on my slides, but I prefer to talk to you, actually. I read from my slides. So the estrogen is preparing the way in the womb and in the cervix, and the cervix is producing the fluids that are making the situation more hospitable for the sperm. So now it comes to a peak of estrogen after, in normal circumstances, about 14 days. And suddenly that estrogen level kickstarts the hypothalamus to kickstart the pituitary to produce luteinizing hormone. Luteinizing hormone causes suddenly the follicle to rupture, release its eggs, the egg released is wafted in by what are called fimria, which are the end portions of the fallopian tube, wafted into the fallopian tube to be guided gently down to the uterus. In the meantime, what's left of the follicle becomes a corpus luteum. It's called corpus luteum, which actually is generating progesterone. And as the progesterone builds up now, temperature suddenly spikes. It goes up 0.5 degree. And now for the rest of the cycle, the temperature should remain up. And if there's been the egg release now will last only for 12 hours maybe. So there has to be semen sitting there ready to go. And if it's not fertilized, then there will be no implantation. The corpus luteum will run out of steam after 14 days, stop producing progesterone. Suddenly there's no support for the womb. The lining of the womb comes away and the period starts. On the other hand, if there is a conception, if there's sperm there, then the egg fertilized gets to the womb 7 days later, starts to implant. After 3 days more, it's sending signals out to the corpus luteum to continue to produce progesterone until 6 to 8 weeks later, the placenta takes over producing the progesterone and pregnancy continues. So I'm just giving you that rundown because I want every lady to know her fertile situation. And she can know that specifically by following the quality of her cervical fluids, because when there's no estrogen, the vagina is dry, no help for the semen. And then as the initial phase of the cycle is underway, after a couple of days a week, there starts to be some sticky secretions. And then when it comes to a day or two before ovulation, it's suddenly a long string of it's like the white of an egg. And this is the most fertile mucus or fertile cervical fluid that a lady can be aware of if she just attends to it. And then she knows she's fertile once that appears. And that's the time, if she wants to conceive, is the time to go for it. Now, after she ovulates, then the estrogen drops, the cervical fluid is no longer hospitable. So a lady should chart her cycle. She should monitor her cervical fluids to know the actual date when she's fertile and to confirm it by following her temperature first thing in the morning. And she should engage her husband in this so that she lies in bed while he sticks the thermometer in, goes off to the toilet and then comes back after and just takes the thermometer out and notes the temperature. And so he should be involved because he should take responsibility for the conception as well as the lady. So a normal cycle is not necessarily 28 days. It can range from 21 days to 35 days. You can ovulate as early as 8 days or as late as 20 days. You need to know when you're ovulating. That's why you need to follow your cycle in terms of the cervical mucus and the temperature. So you know exactly when. And it will save you a lot of hassle actually as well. Your temperature can't indicate your fertile day because it rises only after the ovulation has happened. So it's a bit late. And when you know your cycle, you're monitoring your cervical fluids, you're monitoring your basal temperature first thing in the morning and the position of the cervix, which retracts when you're fertile and opens up. And so I would recommend a book, Taking Charge of Your Fertility by Tony Weschler, to give you all that information. So another point to bear in mind is your menstruation, because the menstruation, as Raj pointed out, is a very important self-healing mechanism, which allows you actually to cleanse your physiology, but it also is much more. It reconnects you with your wholeness. It's a time to go within and to, as it were, wake up and start a new cycle of life, a bit like, you know, the 21st of December, when we shift from increasing darkness to increasing light, then the cycle for a lady is starting again to bring life. So in health, it should be perfectly easy, comfortable, but also, it's very important that you take care of yourself from your menstruation, because if you do, you'll have healthier cervical fluid, a healthier ovum, healthier womb to nourish that ovum, and then a healthier conception. So in your menstrual cycle, take time out for rest, enjoy very light activities, no stress, a light evening meal, early to bed, keep a regular routine, have moderate exercise, 15 to 20-minute walks maybe. Attend to your needs and your happiness, and have a very light diet, but take a shower, not a bath, because a hot bath could increase the bleeding. And avoid sexual activity, because Ayurveda would say the conception around this time is not ideal for the sake of the fetus. And then it's better to use external pads than tampons if possible, because tampons are interfering with the downward flow of apana and have a negative effect. So for both contraception and for conception, monitoring your chart is the key. Know the days you are fertile in order to conceive, or in order to take precautions not to conceive. And if you know your cycle, and if you have been investigated for infertility, you can help your doctor greatly, because you'll be able to tell if you did ovulate or if you didn't. Maybe you had a long cycle and then you had a bleed, but the bleed was actually a very early miscarriage. Most miscarriages happen in that very early stage. But the very fact that you should know that by charting means you save yourself some very uncomfortable investigations, and very expensive ones. You will be able to tell your doctor, I'm ovulating. The problem is implantation. The problem is to hold on to it when it's implanted. So already the doctor can, focus his fertility treatments. In the same way, from an Ayurvedic point of view, if you're monitoring your cycle, you might say that your temperature is slightly low in the initial first phase. And that being low tells us kapha is too much, and we need to balance kapha more. Or it could be too high. It could be to do with hyperthyroidism. It could be to do with drinking too much alcohol or doing too much exercise. And that would tell us too much pitta that we have to balance. Or it could be that there's an irregularity, especially in the second half of your cycle with the temperature, which tells us vata is out of balance. And if not implanting, it tells us we need to nourish shukra or ojas. All this you can help your Ayurvedic doctor with by virtue of knowing your own cycle and knowing whether you've conceived or not conceived, which your temperature chart will tell you. So for conceiving then, the moment has come. The atmosphere of conception affects the mind and emotion of the unborn child. So the old Vedic texts recommend a pure, clean, pleasant environment, pleasing to all your five senses, both partners wearing clean and pleasing clothes. The best position to choose are even described in the old text. And especially important is that a woman enjoys a pleasant and relaxed state of mind. And at that time, it's advised the husband and the wife have uplifting thoughts to attract the pure and high-minded soul, but most of all, a strong feeling of love and desire for each other. When it comes to infertility, both men and women are equally likely to be the problem. Male infertility, 30%, female, 30%, combined 10%, unexplained 25%, other 5%. For men, it's very easy. Even it's the most enjoyable medical investigation a man could have, because he's to produce in that consulting room that he's left alone with the container a specimen of semen. And they can immediately see if he has enough semen or if it's mobile enough. But if not, they can investigate, has he an obstruction? Has he got an infection? Has he got some antibodies? Or are his testicles failing? But simple things for a man, if his weight counts as well, so if he's near his perfect weight, that will be healthy. But another thing is to avoid excess heat, because sperm is very sensitive to heat. So avoiding saunas, hot baths, laptop computers on his knee, tight underwear, working in front of a hot oven. Another thing is he should consider stopping cycling if he's slightly infertile, because it doesn't help the testicles, and it's a bit hot down there at the saddle as well. And a reduced frequency of ejaculation may help him to build up more semen for good response. And finally, if the man's the problem, with the remarkable advances in fertility clinics, they can now even extract whatever little semen there might be from the testis to use for fertilizing the lady. For ladies' infertility, much more complex, because there's hormones, there's blocked fallopian tubes, there's even anxiety about getting pregnant that can interfere. And in some cases, there's nothing found, but that's where Ayurveda is so useful, because it's so subtle, so subtle things happening that Ayurveda can pick up in Vata, Pitta, Kapha, in Shukra, in Ojas, in the functionings of the male or females, physiology and health, that simple issues like the herbs, the lifestyle can rectify. And so if we talk then about the child, do you want a male child? Do you want a female child? In Ayurveda, they said for male conception, take foods to build bone for 3 months before aiming to conceive. And then conceive on a Sunday, Tuesday, or Thursday on day 8, 10, 12, 14, 16, or 18 of your cycle, and use choral preparations like MA321 or MA1832. For females, they said, aim for a Monday, Wednesday, or Friday on day 7, 9, 11, 13, 15, or 17 of your cycle, and consume foods that build up fat tissues. But what did the modern medical perspective on it? There is a theory, actually, which is very interesting, and a lot of discussion, of course, about it. But it's based on the weight of the semen, because a male semen is lighter. He carries a Y chromosome and an X chromosome, and being lighter, he's faster. But the female, the semen that contains the female has 2 X's, which makes it heavier, slower, and tends to live longer. So the idea is to know exactly when you're fertile. And if you want a man, hold back until just when you ovulate, because the man's going to get there first. Whereas if you want a lady, you go early, because if you go 2 days before you're ovulating, then the male will all have burnt himself out, and it's the females that are sturdier and are likely to survive. So there's an interesting perspective, and they claim up to 80% right, but I don't know. Anyway, when it comes then to the success of the whole endeavor, you're beautifully pregnant, happy as the day is long, best no negativity, keep happy, enjoy nature, spiritual pursuits, enjoy reading, avoid quarrels, frightening films and the like, get sufficient rest and sleep, avoid strenuous work, gentle yoga, but no inversions for the first 3 months, and then have the advice of a yoga teacher. Fulfill cravings as far as possible. Take really good nutritious foods, again, rice, dates, milk, ghee, almonds, raisins, wonderful foods to support. Hold in mind who you want your baby to be, and then be with other mothers. Think about babies, plan for the baby. All this makes the baby in the womb feel welcome. Strangely, it says chooses white, but not black or red colors. And so that's about pregnancy. I suppose there are 3 books that I would suggest. And one I've mentioned is to use the taking care of your own fertility to really understand your own cycle so that you can take control. I love this book, A Woman's Best Medicine by Nancy Lansdorf. And then another book is For a Blissful Baby by Kumara Reddy and others. So I'll hand back to Noel.
Great, Don. Yeah.
I was afraid you'd fallen asleep.
No. How could you fall asleep during that talk? I'm still trying to get my head around half that information. Mondays and Wednesdays, and cycling as well. There's a lot of stuff in there to digest that, you know. Anyway, thanks very much, Dr. Brennan. Actually, I knew you hadn't put your slides on, but I've always said that I prefer me personally, when I'm looking at a presentation, I prefer just to look at the speaker, and then later on you can read the material if you want. So I think it was really, really good, you know. So I tell you what we're going to do. I'm not even going to try to surmise that. There's just there's too much in there for me to start talking about. So what we'll do is we'll take just to get up and walk, stretch around. Now we're only taking, let's say we take a 3-minute break, okay? Just so people get up, walk around, do a bit of a stretch, and then we'll come back for Dr. Naheed's presentation. So just 3 minutes. So we're starting again in 3 minutes. So get up and stick the kettle on or whatever you want to do and have a little walk around. So there's some questions in there for you, Don. Can you confirm the author's name? Maybe I'll unmute you. Hang on a second.
Reddy, and it's it. Kumara Reddy is the author of the book for Blissful Baby book, and Noel will be sending out the information that contains those 3 books.
Okay.
Maybe 5 before you're on.
We're on now, Anne.
There's a question about soy. Maybe one of you want to answer that. That's come up a fair bit on our other courses.
Yeah, soy would not be recommended in Ayurveda. It's very hard to digest, and one of the downsides for fertility point of view is that soy will interfere with the thyroid. So a lot of ladies suffer hypothyroidism, even borderline. But you know, when they give up the soya, their thyroid function improves. So Ayurveda would say it's really indigestible. In the Japanese tradition from which it comes, they know how to prepare it in ways that make it digestible. But we can't trust the food industries to do that for us.
Yeah, and I think it's one of the most genetically modified crops in the world as well. So, and it's probably one of the most destructive as well, because it's used for animal feed a lot as well. So, yeah. Anyway, so we want to avoid, in general, we want to avoid GM food if we can.
The phytoestrogens in other foods are good, you know, not the soya phytoestrogens. You don't need them. You have them in grains, you have them in nuts, seeds, and so on.
Okay, so we're moving on. I think everybody's had a bit of a stretch, so I think we'll get back. So I'll introduce Dr. Naheed. So Don, I'm just going to put you on mute if you don't mind.
I start.
Thank you. And Dr. Naheed, you're unmuted. So Dr. Naheed, again, is in India. In India, the term is Vaidya, and a Vaidya is an Ayurvedic doctor. And to become an Ayurvedic doctor in India, it's a university degree course. It's a 6-year course. And not only is Dr. Naheed a Vaidya, but she's a gold medal winning Vaidya as well. And she won a gold medal award for, I think it was to do with the use of herbs and the nature of herbs and all these things. So anyway, Dr. Naheed, you're welcome along, and you can go ahead and you can make your presentation. If you want to share your screen, you can do that, or if you want to just talk, it's up to yourself, you know.
Thank you, Noel, and hello, everyone. Very welcome along to all the beautiful women and everyone and rest of the people as well. So today I'll be sharing with you an insight of menopause with an Ayurvedic approach. So I think I should share my screen first. So you all will be very happy to know that Ayurveda, the classical texts of Ayurveda, actually don't consider menopause as a disorder. It's just a phase of life, you know, like puberty, like your pregnancy. And this phase of your life can also be managed like very easily with some little extra care and some little attention. So how like the phases, there are phases of menopause. So Ayurveda believes that when you are a kid, when you are in your teenagers, then you are most predominantly by kapha dosha. But when you grow up slowly, and then in the middle phase of your life, you are mostly predominant with the pitta, and on the later phase of your life, you are predominant by vata dosha. So before a woman completely goes into a menopause phase, uh, she remains in a phase which is called as perimenopause. So perimenopause is a phase where you start missing your period. You know, you get period for 2 months and then you don't get 2 months. Again, you start getting that. And I think that this is the nature signal that gives you a signal that this is your transitional phase from a pitta stage of your life to a vata stage of your life. And I believe that this is the window period of our life where we can be fully prepared to embrace a new phase of a life. Then we have menopause. So when women don't have periods for 12 months, that is considered to be a menopause phase of the life. And depending upon the uh, balance and imbalance, like balance means prakriti or nature's natural body constituents, and based on the vikriti, imbalance in your body, different women experience different symptoms. And I strongly believe that if you know your problems, if you know your symptoms properly, then only you will be able to come up with the effective solution. So what your symptoms are telling you. So if you're having, like, different women have different kind of symptoms. So if you're having symptoms more to do with your mood swings, you're very anxious, you're worried, and you're experiencing a dry skin, it can be your dry skin, it can be your vaginal dryness, you are finding it to be hard to pass motions every single day, and then you are having sleep disorders, maybe you're not sleeping well, or maybe you're just sleeping for 4 hours in a day, and you have really scanty bleeding, you know, during your menopause phase of the time, and you don't have libido, so your libido reduced, and then bone loss. So how you can experience that you're having a bone loss, you start having aches and pains in different part of the body. So all these symptoms tells you that you need to focus on your vata. You have to start addressing yourself to balance your vata doshas by food, by lifestyle. And then there are some of the women who are like more kind of having hot flushes, that's followed by a profuse night sweat, and sweat can be in the daytime as well. They have some skin disorders, like they're developing skin rashes, the redness on the skin. They are highly irritable, like, you know, that they are like really angry and they don't know why she's angry. and they have heavy bleeding during menopause. So all these situations, when you're facing these symptoms, then you need to focus on the pitta. And along with pitta, you need to focus on your ama as well. Ama is a metabolic waste. So hot flushes, why you feel hot flushes, why are you not hot all the time? That's because you have a lot of build up ama in your body that clogs all the channels in your body. And our body's natural tendency is to eliminate which is not required by the body. So all this heat starts getting built up into your tissues, and then you suddenly have a hot flush followed by sweating. This is your body's natural defense to combat, to overcome the excess heat which is there in your tissue. And then you have some of the women have, like they have issues like they are developing edemas, maybe the swelling around their eyes, and they have a swollen feet, and they can be feeling like, very heavy, they are gaining lots of weight, and they feel like really sad, depressed, like, they don't have like, proper concentration. Then you need to address, to focus on your kapha. You need to be indulging in more balancing your kapha doshas. And as I am strongly say that the more imbalance you are, and the more severe will be your symptoms. So you need to prep up yourself. Similarly, like when you start having, when you plan to have pregnancy, you start having folic acid. Similarly, this menopause is another phase of a life, and you have to start preparing yourself from your late 30s. So start just focusing to, balance yourself. So how you can balance, how can you prep up to balance yourself? Diet. Diet is the huge thing in Ayurveda. So whatever you eat, that makes your body, that makes your tissues, that makes your ojas. So you need to focus on eating healthy, fresh cooked food. You need to be eating your main meal in the middle of the day. And if you follow this simple thing, what will happen, that will keep your agni healthy. And agni doesn't mean only about, your digestive capacity. Agni is the metabolic factor. Agni is your transforming factor. So when you have strong transforming factor, then you make healthy tissues. And when you make healthy tissues, then you make healthy ojas. And ojas is your shield that protects you from every situation and condition. So, we see around people like some catch colds and they recover might be in 2 or 3 days, and some are like have to like deal with it for 10 days. Why? Because the person who is recovering fast, who is like resilient more, they have good ojas, they have good plenty number of ojas. And those who are finding it to be difficult, then they don't have that much of ojas, so they need to focus to build up more ojas. And then lifestyle is also very important in keeping you and finding your balance. Do yoga, Surya Namaskara early in the morning, do pranayama, and especially those who are suffering with hot flushes kind of thing, then they can do Shitali pranayama. That's really easy to do. And pranayama helps you to calm down your mind. That also helps you to sleep better, which is required into this transitional phase of your life. And there is one special exercise for your pelvic muscles. So there is a Kegel exercise. Very simple. What you need to do is contract alternatively, just contract your pelvic muscle and relax your pelvic muscle. But do not put much pressure onto your abdomen. And you can do that like twice a day, maybe 15 times at a time, and twice a day. That will help to keep your pelvic muscles strong. And then sleep. So there are a lot of women who have a difficulty in sleeping. They cannot sleep. Even if they are sleeping, they are getting up middle of the night, or maybe they can only sleep 4 to 5 hours. So I have some tips for you to induce a good night's sleep. So you can do a head massage. So you can opt for coconut oil. Coconut oil is really good for your hair as well, because you start losing your hair in this phase of your life. So take some coconut oil, warm coconut oil, and massage your head before you take shower. You can take hot foot bath. So take a tub, and put it with hot water, and just keep your feet into that tub for 10 minutes before you go to sleep. What this do is that releases your cerebral congestion, which helps you to sleep better. And then the golden milk. So milk is really, especially, milk is really helpful to induce good sleep, especially when you use with some poppy seeds, like a half a teaspoon of poppy seeds in that. That will give you a very profound and a good night restful sleep. And then the most important, self-care. So just relax. You are now in the phase of your life where you have done a lot. You have studied, you made your career, you have given birth to your child. Now it's your time to relax. Just be around the family, spend time with your family, friends, your grandchildren, children, and indulge yourself in whatever you like. And you can massage yourself. So massaging is very very important, therapy, and very economically very friendly therapy, which you can easily do at your home. The oil is the Sanskrit term for oil is sneha, and sneha also means by love and touch. When you touch someone, that's a kind of expression of love. So when you massage yourself, you're letting yourself know that you love yourself. You're spending more time with yourself. You're relaxing. And go for a walk is highly recommended. Go for a walk 30 minutes in any park or in any woods with your friends if you like to spend time with them. Or maybe you can just take your headset and just put it in your ears, listen to your favorite music, and do a walk. And then there is a rose water spray. So whenever you feel like you're very tired and you are having hot flushes, you can keep your rose water spray in your bag, and you can just spray all over your face. That's a very good toner as well, that tones your skin, especially you start developing all the wrinkles over here and around your jaw and mouth. So that tones your muscles as well. So now I have some recommendation to make your own tailor-made spice mix. I have some recommendation for your warming spices like cumin, caraway seeds, and fenugreek seeds. So I'll give special attention to fenugreek seeds. There have been a lot of studies which has found that fenugreek can be really helpful to adjust to support your whole transitional phase, the menopause phase of your life. That helps you to balances your hormones and all the vata. So warming spices will help you to to calm your symptoms, like which is mainly because of vata and kapha. And fenugreek seeds also helps you to build up a good hair, because you start losing your hair, and that's really good for your skin as well. And the cooling spices will help you to calm down your pitta, like coriander, fennel, and rose petals. All you need to do, just take the spices, make them the fresh seeds, and you can make them into a mixture of your own. So if you're looking to balance your vata and kapha, then add warming spices more, and if you're looking to balance your pitta, then add cooling spices more. Just prepare it for in a small airtight jar. You can sprinkle that into your food. You can make your herbal tea out of the seeds. And fenugreek can be used in three forms. So you can use its seed, you can use it fresh, the leaves are available in the market, or you can use the dry leaves, so and that gives a really nice aroma in your foods as well. And then I have a recommendation of some of the foods: raisins, dates, saffrons, and milk and ghee. So this is a time where you experience a lot of vaginal dryness, skin dryness. Ghee will really help you to combat all this dryness, to cut down all this dryness in your body. And milk is very lubricating. That's good for your bones as well. That gives you calcium, natural calcium source from the milk. And raisins, dates gives you enough of energy to survive the whole day. And saffron, it's a very good tonic for women's health, for your skin, for overall. So it balances vata, pitta, and kapha as well. And then I have some special recommendation for osteoporosis. So osteoporosis is a very concerning symptom which women experience. So what happens is that when you start go into your menopause phase of the life, then you start declining collagen bone matrix into your body, and that leads to bone loss. Your bone density start decreasing, and this is a concernful factor because every year you start losing your bones 5%. That can make your bone very weak, that you can have fracture in just small, if you're getting hurt or maybe you're falling down. So you really need to take care of your bone, and bones is always related to vata. So you need to focus on your vata balancing diet and the lifestyle. Abhyanga is the best friend for your bone health. So do Abhyanga with warm sesame oil. And if you find yourself like really imbalanced with Vata, then you can opt for Vata massage oil. Do not do heavy strenuous exercise. It's not at all required by your body. Do slow gentle exercises, where you can facilitate the movement of each single bone, your palms, your wrist bones, your ankle bones, your knee joints, and just give a good amount of movement in all your joints, and add some natural source of calcium, vitamin D, and have some protein rich foods. So protein rich foods can be moong dal, it can be lentils, and if you are like opting for a non-vegetarian, then you can go for eggs, chicken, whatever you like. Okay, that helps you to build up a good collagen into your body, and that will support your bone health. And take regular intake of bone supplements. I'll discuss that later. And indulge into, keep balancing your vata and pitta, take a good care of your vata dosha. And then if you have not taken care before, and you have already started some of the symptoms, then do not worry, we have some of the preparation to support you. One of them is menopause temperature balance, which is helpful in managing your hot flushes and sweats, because it contains sandalwood and the red coral and licorice. All three herbs are really cooling, especially red coral. Red coral also gives you, red coral is nothing but a natural source of calcium that contains calcium carbonate, so that can give you that calcium supplement as well. And then we have another preparation, which is MA939, which gives you a support, I can say, that really helps you to balance all your vata, pitta, and kapha. That's useful, in managing your mood swings. It contains some of the herbs like amla and mir, which balances all the three doshas, vata, pitta, and kapha. And then you can prepare yourself with some of the rasayana. We have MA222, which contains herbs like ashwagandha, shatavari, and amlaki. Amlaki is Indian gooseberry, and shatavari is Indian asparagus. These three herbs are considered as rasayana herbs. So, in fact, amlaki is considered to be youthful, youth preserving kind of rasayanic effect in it. It, so you can opt for MA222 from, when you are on your early 40s or something, like you can have it for, like you buy a container and you just continue having it, and then just put a gap and then you again have it, that gives you overall support. Like ashwagandha balances your vata, shatavari is a very good tonic for women's health, and amlaki preserve your youthfulness. And then we have calcio cure. It contains red coral, praval, which is called praval in Sanskrit, that gives you cooling effect, as well as this is a good source of natural calcium. And then I have few recipes for you. So I have a calming herbal tea recipe for you. So your basic ingredients will be cumin seeds, coriander seeds, and fennel seeds. I have given this recipe in detail in the notes. And if you are having some specific symptoms, then you can add some extras, like for hot flushes, you can use rose petals, and shatavari powder. And for your mood swings, you can add hibiscus flower. And I have another recipe which is called nourishing rice pudding, and we call it as kheer. So kheer is one of my favorite dessert. You can use in kheer like rice, milk, saffron, rose petals, and raisins. Do not add any sugar, because sugar increases more production of wrinkles. And if you want to eat it like really sweet, then you can add some of 1 teaspoon of rose water in that, and maybe some of the dates to add more sweetness in your kheer. And I have a detailed recipe, like I have given a detailed recipe about this in the notes. So thank you. This is all from my end.
Okay, Dr. Naheed, that's great. So we covered a lot of information there. So thank you very much for that. So what we're going to do now, and don't worry, as I said, I will be sending out notes about this. We have prepared notes that we're going to send out. So I'm not sure if there's questions coming in. If the doctors want to take a look at the chat box there, I'll unmute the. So Dr. Brennan, you're unmuted.
Thank you, Noel.
Dr. Rajvinder. Oh God, muted again.
Yeah, thank you.
No problem. No problem.
Rajvinder has been doing marvelous work answering these questions.
Yeah, so that we can
We can,
everybody get answered and we can finish on time.
yeah, well done.
It's a question for Naheed.
Yeah, I'm looking at my questions.
For
So
some-
what rice you can use any rice. So if you use basmati rice, that gives a really a kind of aroma in your kheer, so you enjoy it more. But you can use any rice of your choice. There is nothing like you can use this or that.
There was a question about anti-conception advice, and that's why that's from Astrid, and that's why I was suggesting reading the book, because it's not actually the Billings method. It's a little bit more refined, and it would allow you to predict precisely when you're ovulating, and then gives you advice around what times to be very careful, and then introducing like barrier methods at that time. And that combination of the use of that natural approach of just knowing your cycle and knowing when you're fertile and avoiding intercourse at that time, or alternatively using barriers like the condom at that time. I think, Astrid, it would certainly not have the side effects that the pill might. And it's quite a refined natural approach to conception. Another question was about tempeh and fermented soya products. Does make them more digestible at least, but I still wouldn't be recommending them from an Ayurveda point of view, and I wouldn't recommend them if you were considering your fertility.
Yeah, as Dr. Brenning said, knowing to what is the fertile phase of the cycle, and if you want to use it for anti-contraception as a contraceptive purpose, it's actually work. I say in the Asian countries, probably that's the most popular way that women are already tuned in with their system. And I don't think many women will go around taking hormonal pills or the coils or things. It's more common now probably to use these kind of pills and stuff. But still you can use a natural way of it. And I said that like the carrot seeds, castor seeds, but you cannot rely on that. I cannot guarantee that they definitely be like there is a preparation called Raja Pravartani Vati. So if you're just the dose, that is recommended for as a natural contraceptive, but depends on the age and depends on if you take precautions, I think. But I say, yeah, read the book and get a clear idea. And that's how you will be able to train. I think that was the question for Astrid for me.
So any recommendation for wrinkles? You can use, wrinkles are mostly because of the dryness. So you can keep your skin moisturized well enough. You can use milk as the toner, to clean. Like instead of using any cleanser from the market, you can use milk to cleanse your face. You can use rose spray, water to spray in your face as a toner. And you can apply ghee if you have already developed wrinkles, so that will help you to like not develop much faster wrinkles when you are like really lubricating your skin.
Yeah,
We have
actually,
a very nice revitalizing face oil. It's a lovely one. And that's very good for after 40 to use. I'd say it's a lovely.
Body oil as well.
Yeah, but it's hard to access, but we have the facial revitalizing oil.
And we have the anti-age cream as well, which is an anti-wrinkle cream,
Mhm.
an anti-wrinkle Ayurvedic anti-wrinkle formula. Yeah, on the website.
Yeah, that will help the apply the rose water. Rose water is, as Dr. Nahid said, natural toner, and then a drop of facial or rosehip oil or this facial revitalizing oil. Just use a drop and upward movement, massage it upward to tone up your skin. I think that you could do twice a day, and use some natural face masks make from rice and lentils and turmeric. You can do that once a week. Massage your skin with it. That help with the saggy, and it could be a vata condition, or when you too much heat in your skin, heat in your body. So it could be a vata pitta imbalance. So address that as well. Um, I'm looking at the question. You're all looking at the question.
So there's a question where when you talk about rose petals, hibiscus flower, etc., where you can buy this in our website, and use Indian hibiscus. Do not use the hibiscus which is grown into the western part. So
We have that on the website. We have Indian.
to balance.
Yeah, it's an Indian one on the website.
Yeah.
And Kerry is saying, so one who experiences vata imbalanced menstrual cycles be wary of early or strong menopause. Thing is, if you come into the menopause balanced, it'll be just so easy. And I mean, some of the visiting Vajas from India were amazed that ladies had problem at this time, because in India, the ladies, particularly in traditional areas, will know how to take care of themselves in such a way as they keep a balance. So it doesn't matter whether you're experiencing vata imbalance, pitta imbalance, or kapha imbalance, just get balanced before the menopause for a comfortable menopause.
I think that
So
Dr.
that
Ryan,
it goes
keep
easy.
the shared jobs, the house jobs are shared between people, and less pressure. As I said, ask for support, ask for help. Nowadays, we are trying to be a superwoman and driving our adrenals, our pitta is mad, and more the pitta is mad, more the menopause will be bad.
General cycle regulator for perimenopause, MA, the menopause support.
939, MA 939, yeah. And somebody said,
There's a question regarding rice pudding. So, do you use the whole grain? Yeah, you have to use whole grain. Wash it properly, soak it for around 30 minutes. Then it will cook faster for you. Okay. And boil it to very soft and tender consistency. And then you can follow the rest of the recipe.
I think Philip Sterling's question is good. Could Shantavri imbalance estrogen? I think if you have a very high estrogen, I probably wouldn't tend for Shantavri at that time.
Yeah, you go for Jatamansi instead, because Shatavari is rich in estrogen, and Jatamansi will balance the high estrogen in the body. And then the good book for menopause, Jacinta, will be Beauty After 40, Dr. Nancy Lansdars. And Dr. Brennan recommended Ladies' Health, the same author, Dr. Nancy Lansford, Beauty After 40. That's a very good book for menopause. A lot of recommendation around osteoporosis, wrinkles, HRT, everything.
And there's a question regarding herbal remedy for osteoporosis. So we have a preparation which is called Calcio Care, and you have to, like, if you are having symptoms of osteoporosis, that means you're having aches and pains, massage yourself daily with oil, with vata massage oil, and introduce yourself with the spices. Some of the warming spices will help you to digest your food properly, and that will ultimately help you to form healthy bone tissues. So yeah, you can focus to have like cumin and ajwain, all this, and rock salt into your diet. That balances vata.
And it's very sublime, really, Ayurveda, because, even taking one thing, that sesame seed oil is the best thing for as massage for balancing vata. Well, sesame seeds are the richest source of calcium that you find in any food. So the oil is really nourishing, and it's not only soothing your vata, it's nourishing your tissues and giving specific nourishment to bones. So that's the beauty of Ayurveda. Any one strategy has holistic effects, and the synergy of a couple of strategies is so powerful. What if someone has already started HRT? Well, my suggestion would be you read the book by Nancy Lansdorf. Is this woman, so that you know what you're doing, that you have a consultation, that you introduce Ayurveda so that you can get off the HRT. HRT is, if you were creating health, becomes a little bit more redundant.
So there is a
Dr.
question about,
Rajvinder is muted. Oh, and she's not anymore. Yeah.
Yeah, I'm okay now. Sorry, thanks. Yeah, go ahead.
question. If one's menstrual cycle days have reduced from 7 to 3 days, that's completely okay. If you are like, you don't have to bleed too much. It's just 50 ml on an average. You have to bleed in your cycle. So when you start your puberty, we women have more flows. It lasts for longer days, but over the period of time, as we age, like when we are in our late 20s, early 30s, then most of the women have 3 day cycle. And if you're not having any other symptoms, if it's not that painful, if your flow is not having any kind of smell and other things are fine, then you don't have to worry. That's completely okay.
Yeah,
So-
I just like to say something as well, because there's a massive amount of knowledge going out here, but I always say this on our webinars, all of them, this is to give out general information. It's a webinar to give you an idea of what Ayurveda has to offer in these areas, because sometimes people think, well, there's nothing I can do except go to a Western doctor and take, medication or do whatever. If you can't conceive, you go on IVF, and if you're having menstrual problems, you go on tablets or whatever. But this is to let you know that there's a whole other approach to these problems, a hugely sophisticated approach to these problems. But if you are having issues, I advise a consultation with a doctor. Go under the care of an Ayurvedic doctor so that a proper plan can be made. And all of our doctors, even during the lockdown, are available for consultations via Zoom. So I think that is important. There may be lots of general things you can pick up, but if there's something serious or you want to put yourself on a proper path, then have a consultation with a doctor. Sorry, Don, go ahead.
Phytoestrogens, what foods are rich? You're thinking about whole grains, nuts, seeds, and legumes, which are the pulses like chickpeas, kidney beans, lentils, and so on. And from Eleanor, what if you're susceptible to calcium deposits? How do you manage this in osteoporosis? I think it's interesting, that one. If you're using a calcium supplement which has been prescribed, it could well be, just calcium. And we weren't designed to be chewing the cliffs of Dover or taking inorganic minerals into our system, and they're not likely to be as easy to handle as organic. And that's why Ayurveda is using organic sources of minerals, specifically a lot of the seashells, which pearl, oyster shell, that are refined through Ayurvedic processing and given with herbs, so that those minerals are transformed into bones and not into deposits. But there certainly seems to be some sort of metabolic disturbance if calcium deposits are being laid down otherwise. Due to Vata imbalance, Vata creates hardness. And so it's a matter of balancing Vata, sorting out the metabolisms, and taking the appropriate minerals to support your bones.
And regarding hot flushes, I would say that if you are smoking or if you are like drinking on a regular basis, then you have to really consider in reducing the amount of alcohol intake and your smoking, because these things are cannot help you to balance your pitta. So just slowly reduce the alcohol intake, and if possible, quick smoking.
Niamh, with the endometriosis, maybe a consultation is best to manage that, so you can get off the progesterone-only pill. And anything for wrinkles, well, ladies, I don't know if you've already answered anything for wrinkles.
Yeah, actually, Dr. Naheed is going to be doing a skin beauty webinar. It'll be a month or two away. But
wonderful. No, you and I are first down for that.
Yeah, I need that. Yeah.
Yeah, me too.
And Dr. Brennan is going to be doing putting together a webinar on the thyroid, specifically on the thyroid. And Dr. Rajvinder will be doing a cookery course. We'll be doing an online cookery course soon as well.
I'm planning to do an autumn one, and then I might be plan to do one on the children health, but yeah, it takes time to put everything into on the slide. So.
And there's lots of people saying about The Woman's Best Medicine by Nancy Lonsdorf. So I see Rita is saying that she read that book and it completely changed her perspective. So she is a Maharishi Ayurveda physician, Nancy Lonsdorf, and yeah, that's probably Ageless Woman and A Woman's Best Medicine, and that one you mentioned, Dr. Rajvinder, Women After 40, I think it was. They're all by Dr. Nancy Lonsdorf.
Dr. Nancy Lonsdorf,
yeah, they're great books.
Yes, Swati is saying we will be told by the thyroid one. Yes, we will be having, I think.
Oh yeah, make sure you're on our mailing list. I think most of you probably are, but if you're not, go to our website, ayurveda.ie, and subscribe to our mailing list, and then you'll be told about everything. And just make sure you're getting the emails, because most of them seem to go into promotion folders or spam folders or something like that. But you know, or you can drop me an email, noel@ayurveda.ie. The thyroid one will be next. I'll be organizing that in the next few weeks, and a replay of our arthritis webinar, which was a fantastic webinar. We'll do a replay of that in November. We'll do the thyroid one, and then we will we'll look out for the nutrition one and the skin health one as well. But you'll definitely be kept informed of all of them, you know.
So there's a few questions coming in about calcium, and very good foods that create calcium are your greens, your leafy greens, broccoli, kale, lettuce, collard greens. Calcium is good, turnips are good, and then the legumes we were talking about are good. Dried figs, prunes, sesame seeds, sunflower seeds, pumpkin seeds, almonds, nuts. So there's lots of
there is one Asian one, if you can source. It's called lotus seeds, and it's a lovely snack. They're round little white pearl kind of things. You can roast them, make them savory, and they're rich source of calcium. They're mostly available in the Asian stores, but all the foods that Dr. Brennan has recommended, yeah, good source of calcium as well. If you can't consume dairy, there are lots of plenty to have calcium through other. As Dr. Nahid said, the coral, the seaweed, all the preparation from these kind of corals and stuff are rich in calcium, which is part of CalciuCare. So make sure your digestion is good and you absorb calcium. It's not only piling up calcium through supplements.
Exactly.
And I just take yeah, go ahead, Nadia.
Yeah, exactly. Like if you're eating it right, if you're having your vegetables, your rice, your staple food like in good quantity, then all you need to have is just a proper digestion. So your foods have plenty of things. You just need to digest it. You don't need supplement for each and every deficiency. Just eat properly.
Dr. Brennan was talking about Indian women. I think the reason could be a lot of variety of legumes, variety of beans, variety of spices in the diet. That could be the reason the Asian woman has less aggressive menopause symptoms than in the West. And the coffee, as Rita said, it should be eliminated. Yeah, probably big cause for hot flushes and all, pitta imbalance. And the collab here, I don't know if that question is answered. I'll take that. Epstein-Barr virus. That could be bad in menopause, yes. And when we treat in the Ayurveda, we try to treat the pitta imbalance, because that's the inflammation that's going to cause in your system. So yeah, if pitta is very high, the menopause, hot flushes, all night sweat's going to be quite much. So you look into the pitta diet and pitta herbs for dealing with that virus. Isabel said, I know what I'm getting for Christmas. Great. Maybe tell us. No cake, no puddings.
And one thing I noticed is I think excessive exercise, maybe the doctors agree with this or not, but I think excessive exercise for ladies is a bigger problem than excessive exercise.
I mentioned that, yeah.
And, you know, I heard one time, I remember reading a book that, you know, with women athletes, runners, sprinters and long distance runners, that if they weren't amenorrheal, which Dr. Rajvinder talked about, if they hadn't lost their ability to have a period, they weren't considered to be working hard enough, you know, that they weren't, you know, because you just go so far out of balance that the body loses its ability to have a period. And as far as I'm concerned, that's a form of madness, you know. So just be careful with that, because there is this tendency nowadays for ladies to feel that, you know, and all exercise, if you're doing too much, is pushing up vata. And vata causes so many of these problems, you know. So, you know, for vata people, a good walk is enough exercise, or maybe swimming in hot water or something like that, or a little bit of weight training. But long distance running and sprinting and all those things are spin classes. You know yourself, your vata goes out of balance, you can't get to sleep, your mind is racing all the time, you can't keep your thoughts on one thing. It's just, so if that's what's happening with you, then and you're exercising excessively, that can be a cause of it.
So there's a question about how much one should exercise. Like you go for a walk, that's the best exercise. There are too many vital points in your soul. When you walk for 30 to 40 minutes, that those all points gets activated. That really helps you, to digest properly, to transform properly your tissues. And you can do Surya Namaskara in the morning, and some of the pranayama and some of the asanas, and 5 or 10 minutes of meditation, that can be really helpful. You don't need to do much more than this.
There's a question about a good nutrition book with recipes, the Ayurveda cookbook by Morning Star. The Ayurveda cookbook, easily to remember, Morning Star. Ayurveda Cooking for Westerners by Amanda Morningstar. So there you are, two. And Trifle, a good supplement for women. Trifle is a brilliant supplement for everybody.
Yeah. I was going to take some question. I forgot now which one was it. I think the legume was it. I need to change the legume if it's only the moong dal for vata. Of course, if the moong dal is settled in your system and it's okay now, you can eat moong dal with your closed eyes, no trouble, no bloating. Yeah, now introduce the other one now. So introduce the poi lentil, the whole green lentil one, and then let them adjust your system and then introduce other ones. So slowly, if you are sensitive to vata would be, and then using vata churna for cooking, or a bit of ginger and kind of black pepper. So those spices help to digest the lentils for vata.
Can you talk a bit more about painful joints during perimenopause, please? So, what happens when your estrogen start, decreasing? Then you don't make that, your bone density starts decreasing, your bone metrics start declining. Then you don't have, that much strong bones. So it starts aching. You start having pain in your joints, in your pain. That gives you a signal. Your body tells you everything, that you need to take care of your bone. All you can do, just massage yourself properly with warm sesame oil. Okay, eat foods which helps you to digest properly, the natural source of calcium in your body, and do some gentle exercises. The movement of your bones is very, very important. So just give a gentle, slow, gentle movements, your wrist joints, your knee joints, and everything. Do not keep seeking for a long, if you're working in office or something, do not sit for like longer than 1 hour or 1.5 hours. Just stand up, just take a walk for 2 or 3 minutes and then come back. So all this can help you to help a good healthy bones.
Should I stop taking Calci-Chew with vitamin D and take CalcioCare? Certainly you could take the CalcioCare to replace the calcium and the minerals in Calci-Chew, but you need the vitamin D. Vitamin D will be very important, and all ladies, particularly in this part of the world, particularly from September through till May, should be supplementing with vitamin D. The vitamin D is not just very important for your bones, it's important for your immune system, and in COVID times, it would be highly recommended. And Noel does carry a vitamin D supplement in his range of products as well. So, but take the CalcioCare Plus.
I say CalcioCare Plus 50 Plus also be a good choice as well.
Yeah, because that's a good combination of all of them.
Yeah, because someone said the calcium deposit, what they should do. So they combine vitamin K with it to stop the calcification and the deposition of calcium. Vitamin K will process it. I think it's in 50 plus.
Yeah.
And then it has CoQ10 as well for that age group. Yeah.
Someone asked about using sunflower oil for massage. It's a good choice, particularly if someone is pitta and can't tolerate the sesame seed oil.
Yeah, make sure it's organic, cold pressed. And
someone's talking about triphala making them agitated. I haven't really heard of triphala making.
It could do that. It could do that. Yeah.
Okay. So what did it do? Don't take it?
Yeah, then they don't take it. Yeah.
Okay. Okay. So one thing I always do with these courses for the people that have come on, I think there's 71 people on the call at the moment, is to thank you for coming on the course. I always make a voucher available to you that lasts for maybe a week, and it gives you a discount off all the products, you know. So if you're thinking of ordering any products, don't do it yet. Wait till I send out that voucher. I'll try get it out to you tomorrow or Monday morning at the latest, but it'll give you a 20% discount and it'll last for about a week. And we always do that as a thank you for people for showing an interest in coming on in this and, you know, hearing about this knowledge, you know. Okay, I think we're getting very close to the end. If you want to take one or two more questions.
There's a question about is magnesium required for calcium absorption? Is it okay to take magnesium citrate as powder? I would say have nuts, have seeds. They are rich in like multiple minerals and elements. So you don't need to have a synthesized product when you have a natural option.
Yeah, and that's another thing. Vitamins, most vitamins you buy in a supermarket are synthetic. They're made from petroleum, basically. They're plastics. They're a form of plastic, really, you know, and they're synthetic. And there's evidence to say that the body doesn't really know what to do with them, you know, and that it doesn't have the same reaction that it does with natural food state minerals. So we carry a range of, Ayurveda is not huge into mineral supplements and vitamin supplements. I mean, it rather you get everything from your food, but because people's diet and the quality of food is so bad that people can become deficient. So we carry a range of products by Cytoplan for our vitamins and minerals, and they're food state vitamins and minerals. So they're from foods rather than synthetic vitamins and minerals, you know.
They're processed with probiotics. So when they're processing, they're not using yeast. So lots of people could be sensitive to the yeast in the supplement. So in the Cytoplan, they have the probiotics, the good bacteria to process when they are processing in the lab. So that's why their absorption is better, and they're low dose. So low dose and absorption is much better.
And they tend to be in combination as well. I mean, most vitamins and minerals are manufactured in factories in China, you know. So it's and as I say, they're just synthetics. They're a byproduct of the petroleum industry. So.
There's a question about yoga postures to help hot flushes. Well, I'd be suggesting a Shita Pranayama, which is a curled tongue and breathing in through the curled tongue.
Like this, yeah.
It's for cooling.
And the warrior pose. You could get all the anger out on the warrior pose.
Warrior pose, yeah.
Warrior for the yoga. And instead of sun salutation, do the moon salutation and the Shitli Pranayama.
Lovely. And the decaf coffee, wouldn't really recommend it because there's more chemicals in it to try and remove the caffeine. So not a great idea.
Raj's cup.
Yes, Raj's cup is a really good coffee substitute. It contains ashwagandha and it removes fatigue if you're tired.
Do you like it or not?
It's lovely.
No, Dr. Brennan love it. He loves it. I'm going to give him Raj's cup all day.
Well, it's so good. And then a question about how much exercise in your 40s. It depends on your nature. Kapha much more, Pitta moderate, Vata less. You're still in Pitta time of life, so moderate exercise for the time of life. But you really need insight into your nature to decide the best exercise for you.
Yeah, but listen to your body, you know. So
absolutely true. Don't end up panting, and don't end up perspiring profusely because you're pushing beyond comfort towards strain and
15-minute intense exercises. Just do 15-minute intense exercise. Just go to the park, run for a minute and stop, run for a minute, stop, and that's plenty. And then just do a gentle walk. So yeah, breaking, as Dr. Brennan said, just break to the point of sweat, and that's all.
Yeah.
Can you add hot milk to Raj's cup? I think that's not an issue. That's
wonderful.
Fine. Yeah.
Wonderful. Oh, yes. Somebody asking about varying length of cycles. It can just be life because your Vata gets thrown a cycle and then your cycle is a bit longer, whatever. It would suggest a slight Pitta imbalance to be balanced if they're slightly erratic length.
Okay, listen, I'm going to call proceedings to an end here because we're all going to get Vata imbalance if we go on. Sorry, Don, you look like you're about to.
Yeah, well, what gets me is that, like, when it comes to the point where we have to end, the texts start coming through at an incredible rate. There's now 48 messages we're supposed to read.
You got to get your questions in early around here, okay?
Yeah.
Anyway, there's only so much information we can take. I will be sending you, I'll put this up on YouTube. I'll send you the link out. It'll be available for about a week, you know. I'd ask you not to download it and share it with people. You've paid to see it for yourself, you know. So it's but because there's so much information here, and I do accept that people couldn't take it all in the one sitting, I will share the link, but please, as I say, don't send the link on to all your friends and everything like that. If they want to see it, they can come and see it again the next time that we play it, you know. So lots of thank yous coming in, so that's good. Namastes and thank yous. So okay, Don, you look like you want to say something.
Yeah, because Neve is asking the name of the supplement. It's 50 plus, and vitamin K is not the same as potassium. And Philip asked, yes, it is important to take magnesium for calcium absorption. Well put, Philip. But if you take the calcium care, the minerals, it's like these seashells have all the minerals for your bone. That's the beauty of them. It's not calcium, it's not magnesium. It's everything that your bone needs.
Okay,
There's
fantastic.
a very nice comment from Swati. Noel, can you read that, please?
I have to find it, Dr. Naheed. They're just coming in so fast. Maybe you can read it.
Thank you so much, Dr. Brennan, Dr. Raj, Dr. Naheed, and Noel. You're affecting lives in ways you cannot imagine. Amazing webinar.
Okay, thanks very much, Swati. Thanks very much.
Beautiful. Thank you.
The more people we can get this knowledge out to, I mean, people just aren't even aware that this type of knowledge exists. They don't know. They've no choice. They've no nothing there. It's not highlighted. It's not promoted by the medical establishment. It's, if anything, it's discouraged, you know. So but this knowledge is there, and it's absolutely fantastic knowledge. And people may have doubts about it. They may think, oh, you know, it can't be anything good. It's all, but they come on and they listen to it, and then their intellect just says, my God, this makes so much sense. Because it does make sense, but we got to get it out to people. We got to get it out to more and more people. So that's why we're running those free. I mean, we're on our 5th free seminar at this stage, and we will run another one before Christmas as well. So I haven't got the exact date for that, but make sure you all sign up for that. Ayurveda.ie is where you get all the information you need, and make sure you sign up for our newsletter and keep in touch with us, and like our Facebook page, which is Ayurveda Center. But there's a link to everything from the website, ayurveda.ie. Okay, do we sell the books? No, Aoife, we don't sell the books. Just go to Amazon. It's just so much easier to get them from Amazon, and there's so many books that we used to sell quite a few of them, but we can't really compete with Amazon anyway. So it's better that, you know, just get them, or from a local bookseller, but they tend to be on Amazon. But you can get a local bookseller to get them as well. You know?
Yeah, shop local. Yeah,
If they have them.
Somebody commented the sun was on my shoulder, and I thought for a moment the radiance of the goddess was there, and I realized the sun. Yes, I can see it.
lovely.
Okay, so a big thank you to our doctors, Dr. Brennan, Dr. Rajvinder, and Dr. Naheed. Thank you for all that wonderful information. Big thank you for everybody that came along.
And thank you, Noel, for organizing all of this for us. Well done. Thank you.
Yeah, thanks, Noel.
Yeah, it's my pleasure.
You're great. You're so good.
Thank you. Thank you.
It's true.
Okay.
Oh, Noel is so happy, and he's blushing as well.
That's the sun coming through the window.
What did you eat? What did you eat?
Well, I had a lovely dinner actually. I don't want to mention McNally Family Farm again, but I just had with potatoes and vegetables. It was just gorgeous, absolutely gorgeous. Okay, everybody, namaste. A big namaste to everybody.
Thank you.
And okay, we'll see you all again, hopefully. Thank you.
May Mother Divine bless you all with the power, strength, wisdom, and all the healing qualities. Blessings for all. Thank you.
Thanks, Dr. Rajvinder. Okay, everybody. Bye-bye. Bye-bye. Bye.